The next panelist we are going to hear from is another policymaker from Cali, Colombia, Rodrigo Gurrero. So please join me in welcoming Rodrigo.
Thank you. Thank you. It's a pleasure and an honor to be here summarizing the experience I have lived for more than 20 years in Cali. In order to understand, I will try to make this presentation with an historical perspective. I was elected mayor in 1992. My previous experience with violence was zero. I was an epidemiologist more interested in health services, epidemiology, unnecessary cesareans, sections, all these kind of things that epidemiologists in health services do. But I knew that homicide was the most important health problem of the city. By the records, the first cause of mortality in Cali for the general population was homicide. So I decided that homicide was the main priority for my tenure as mayor. I did not attend the recommendations of those experts, politicians that told me, forget about those things. People like to see schools, paved streets, lighting, all these things. They don't like counting dead people. But I said, well, this is the problem I am going to see. What I did is what we epidemiologists do whenever we are confronted with a disease of unknown etiology. We call it presumably, or whatever. We call it the epidemiological method, which is not so. It's the scientific method. And it can be traced back to the Greek philosophers. Aristotle, for example, he was the first one that I know, and this group of philosophers that said that knowledge was acquired by observation. He said, observe. For an observation, you can induce a general rule, and from that rule, you can go back and deduct. If that rule is true, check reality. And this process of observation, induction, deduction is the way to acquire knowledge. It was perfectly described by Aristotle. So it's nothing new. We epidemiologists, we believe we have invented it, but it's not. It's as old as humankind. So what I did was, okay, my idea was it's important what I have to do. The method is first, and this is something we epidemiologists, and if you watch my interventions yesterday, I always try to think that social problems or even health problems tend to have multiple causes. There is no single factor. And we don't call it causes because we get into a philosophical discussion what a cause means. We call it risk factors, which is something that when it's present, increases or decreases, if it's a protective factor, the risk of that phenomenon to be present. So at that time, we say violence, homicide in Cali is a complex phenomenon. And we, from reading the literature, we could identify some factors. We say alcohol consumption, firearms in this cultural behavior, ineffective police and judicial system, organized crime, inequity, more than poverty, biological factors. So with that thing, once we have that, the next step, to me, the most important of all things, is define. And one will believe that, well, the method is make a definition. And making a definition of homicide may seem very simple. It's quite complex, absolutely difficult. And I will tell you all these things we have gone these 20 years to improve it. Make a definition. Then, once you have defined that, go and find who, where, when that phenomenon takes place. Out of that observation, you should have some hypothesis, and plan interventions, evaluate, reformulate, and this is the cycle. This is what most people do. So what we did was, okay, first, and then, Alex, you know that very well. At that time, we were lucky to have the World Health Report, the 2002 report that Alex Bouchard and Etienne Krug have put out, defining violence in the three categories: in self-committed, interpersonal, and political. And we use that definition. Violence is the use of physical force with intention to inflict injury. The two basic concepts are physical force and the intention. If it's not intentional, well, maybe an accident, but it's not. And then it has to be physical force. That has some limitations, as all definitions have. Excludes many other forms of violence: political, psychological, economic, all these things. But the type of violence you see in the city that leads to homicide and injury is that physical use of force with the intention of doing harm. So that was our definition. Once we have that definition, then we went on to see who, where, and when. This is very interesting. Look at this. This is my favorite one. Well, I have so many favorites at this stage of my life. But when in December of '92, I called the police and said, "Tell me how many homicides are in Cali." And you see the red line in the previous month. And then I went to the judiciary people and said, "Tell me how many homicides occur in Cali." And you see the yellow line. Two complete different things. And say, how come such a simple thing as a homicide can be, we don't even have reliable data on that. It turned out to be that police call homicides those found killed in the streets. Those that they took to a hospital and died several days later, they didn't recognize it. Then some time after, we Colombians are very sophisticated, they invented a new category. It's called disease person, whatever that means. So we're not homicide, we're disease. We see, not with us, we see disease. Okay, so, and then the judiciary system, contrary, anyone dying in Cali will be a homicide in Cali. If an injury was outside of Cali, but it came because of hospital care, and that in Cali, that was a homicide in Cali. And they could not go beyond that because it was homicide in Cali. I hope nobody's a lawyer, will be hard. Lawyers are like that. Then what we did, very simple, we put them together. Every week, ever since, we have been meeting weekly, Tuesdays, and we got the forensic medicine, which is, in our case, in Colombia, is very reliable, the police, the judiciary system, the university system, Universidad del Valle y Salva, which is an independent institution. And we analyzed case by case, and we came to the conclusion, as you can see, after January of 1993, the differences were one at most. So we had finally, out of this came a very interesting policy idea. Well, this is not only in Colombia. Look at this. Honduras, for the homicide according to OAS, 33.6, according to UNDP, 60.5, the same country, the same year, two very respectful institutions. So how and this is my discussion with economists. I have a health economist, so we discuss a lot about it. The economists will take this, they run a regression, and they will find conclusions, very fancy, sophisticated mathematical modeling, but the data, to begin with, is unreliable, so it's useless. So what we did, two things. First, to solve the problem, we invented the concept of these weekly meetings. We call it consejos de seguridad, the técnicos, which began to take place, spread in Colombia. There are more than 25 cities that meet weekly, all the interested parties. In some cases, maybe the the firefighters in rural areas with the only reliable information is obtained for the firefighters, whatever. But meet weekly and come to a conclusion. This was adopted as a policy, and we have the IDB and the World Bank have spread it in Latin America. We have this idea of having groups to meet regularly to get reliable data. The other thing, this is blank, but it's even more important. And this is something, Alex, I would like to give to you. Once we have discovered this Honduras business, we went to the IDB and said, look, you economists are losing your time. Why don't you invest some effort and dollars to improve the quality of the data? So we invented the concept of a regional system of standardized indicators of violence. And nowadays, we have 18 countries in the Americas. We selected 20 crime, like homicides, whatever you name them. And we met with all the local authorities, and they adopted this program. I believe we are getting close, and probably if this is supported at the world level, we can get to include these categories in the international classification of disease. We could put some additional digits for external causes of death, and we will have homicide defined, well-defined, etc. It will be a great contribution because each country has a different. Honduras has five different homicide, parricide, uxoricide, infanticide, and asesinato, whatever that means. All will be homicide in one single category. But that to me, will be a great contribution to the prevention. Okay, let's get back to. Once you have the definition, get to find variables. As you can imagine, we were thinking that the drug lords, at that time, the Rodriguez Orejuela brothers, were responsible for most of the killings. This is the age and sex distribution of the homicides previously defined. The red line, you see, is the homicide rates for males, and the blue line is practically inexistent. And there is a disease that affects young males coming from poor areas of the city. That was part of the description. Then we discovered that 2/3 of the killings took place in weekends. So our previous idea that the drug lords were directly involved seemed to be weird, because why do they wait for the weekends to kill the people? And our reflex is anything that happens in weekends, at least in Colombia, probably in some other countries too, is related to alcohol consumption. So we decided to measure alcoholemia. And indeed, this is in Medellin, because Medellin followed the same strategy in Bogotá. Almost half of them had more than 50 milligrams per 100. That was of the person that had died, the victim. In Medellin, there was a School of Public Health made a study of the perpetrators, which is more difficult because they had to take blood samples of the presumed killers. Indeed, they were also drunk. So it was a disease that took place in weekends, but both the victim and the aggressor have been involved in alcohol use. And then most of the times they use firearms. 90% were firearms. Those purely descriptive things. So what we did, once you have that in mind, you say, okay, let's control alcohol and firearms. That independent thing, we did that. And then alcohol and firearms, the two risk factors, we are trying to, without any previous consideration, the theoretical knowledge we know now that neurotransmitters with alcohol, etc. At that time, we did restriction on selling alcohol, stopping at 2 a.m. in weekdays. We call it semi-dry law. Mocus in Bogotá later call it the same one, ley zanahorias. Carrot law, I can explain you later why it's a semantic trick that we use in Colombia. Carrot law, which is more, and then we forbid carrying firearms, which in Colombia are manufactured, administered, sold by the army. Our NRA is the army in Colombia. And then evaluate. In those weekends in which we restricted alcohol selling times and firearms, there was a 35% reduction in homicides. And those in which only firearms were forbidden, it was a 14%. So that was a very impressive result. Interesting, in the following administration in Bogota, Mocus repeated the same experiment, and the proportion were the same, 35% and 14%. So we had identified a risk factor that was very effective in reducing them. Then let's move on to other risk factors. I'm going very rapidly. Cultural factors. To me, this is a theoretical model, so the areas of the pie are the same. To me, it's probably the most important in our case, the cultural factors. And this is something Thomas, we were talking before. Look, this graph gives me chills. But you understand, we epidemiologists are very prone to that. This is the homicide rate in Colombia. Starting in 1999, we had 16 per 100,000. Most Colombians believe that was a very peaceful time. 16 per 100,000 is totally unacceptable today. It will be the most violent country in South America with 16. Then we had in the 50s and 60s a brilliant idea of the two political parties, the liberals and the conservatives, to kill each other to be in power. So they invented the paid killers, which became a social institution in Colombia. People were killed. There was no previous personal relationship between the perpetrator and the victim. Simply, he was a liberal, okay, he has to be shot. And the reverse was true. Then, after this bloody killing that believed was about 300,000 people were killed, we stabilized in 20. And then, back in the early 80s, we began the other sharp rise that is clearly related to cocaine production. And we are back in the 20s. Another piece of knowledge, anything that goes from one year to the other so rapidly is not genetic, because back in my first term, people say, well, as Colombians, we are genetically violent. Now, genes don't change one year to the other, and they go back that easy. So we knew it was an environmental factor. It was political discussion, or was cocaine that was involved, but that was a piece of knowledge that we got from that. Okay, well, this is, I will go over rapid. If you go, we have done extensive surveys, and you approve social cleansing. Social cleansing is a horrible concept that killing beggars, people that are in the streets, it's social cleansing. Do you approve it? You see Caracas, 70% of the people approve that, which is culturally totally unacceptable, but that's like this. One has the right to take justice by its own hand. You see, we are, in Colombia, I will go. The interesting thing is that those factors, taking the justice by your own hand or accepting, is clearly related to being physically punished in infancy. You see the correlation. They never hit and 3 times a week hit. It was almost a perfect correlation. Being punished physically in infancy and accepting these horrible cultural things. I can go on that. Okay, let's move to the other. Ineffective justice. At my first term, the police was ruled by the drug lords. I discovered some years after they were on the payroll. The head of the police, the head of the narcotics unit, the head of the research unit, they were all on the payroll of the. Then anything you have to do is improve the quality of the police. Fortunately, in this 20-year period, it has changed dramatically. And we have now a very decent, with some exceptions, police body. And this is what I try to do. I increase personnel, I give things. This is coming to my second term. I will go. Then I also increased surveillance cameras in Cali. We had more surveillance camera than Bogota, which is 3 times as big as us. We lighted public parks. In poor areas, the social interventions, relationship take place in public parks. The houses are just for eating and sleeping. They don't have a place to. So we put it, and this had a profound impact. Changes. From my first time, 6% of the homicides, in 6% of the homicide, there was a presumed killer identified. In the last year, 55% of the homicide, they were captured in flagrance, and there was a little additional number after the investigation. So improved, there was a tremendous improvement. Strengthening of justice, this is another interesting concept. We invented the idea of the health center for justice. Instead of having people to go to a university hospital for a simple case of diarrhea, go to a place in the slums where they will have the police, the forensic medicine, a woman hit in the middle of the night by her companion, and immediately the case will be opened there, and there will be no possibility of getting back as frequently is because of social pressure that want to withdraw the case, all these things. So we have 3 in Cali. It became a national policy. In Colombia, there are 80 cases. Then inequity, I will just go rapidly. Inequity has been shown is not poverty, it's inequity. It's simultaneous coexistence. This is the homicide map of Cali. Looks like a missiles case, no? But you see, the areas on the right-hand side are the poorest area, the lowest area. Then you see, these are the low. Then, in this second term, we invented what we call, you see here, there, we invented the TIOs, which is the territories of inclusion of opportunity, the lowest, the poorest area of the city, and the most violent. So we focus in social investment. In the last 2 years, we invested $80 million in those 11 areas. We had the highest homicide rate, lowest. We put free 6 cubic meters of water for the 150,000 poorest people of Cali. So that to correct inequity. Then, organized crime. This is a new thing. It did exist 20 years ago. 20 years ago, the drug trafficker said, we don't want Colombians to consume drugs. We will export it to the US. We will destroy the monster from the inside, they say. Now they found that it's no longer possible. The Mexican cartels have been destroyed and all interdiction. So they began to concentrate their efforts in Colombia. And so we have developed organized crimes which are not gangs. People tend to be confused by pandillas or gangs or maras. With organized crime are highly sophisticated groups. And I'll give you, the second term, I noticed that 33% were what we call problems of living together, alcohol, quarrels, etc. And 67 were painkillers. There was a highly sophisticated mechanism. The type of weapons, the hours indicated there was organized crime behind it. So we went to the police, national, and said, look, you cannot fight this with local police, having a police, neighboring police. It requires special groups to fight them. Look, this is an example. Los Humos is a gang that was dismantled in last year. They were responsible for 45 homicides. And you see the places of the city. And they were highly sophisticated. At that time, there was one member of the Fumos that was in Santiago de Chile, the other was in Guayaquil. They were captured at the same time. But the police and the judiciary system spent 6 months tracing back, getting all the interception, telephones. So when they came down, the Fumos was neutralized. So the strategy has been get to the anthill rather than to the ants. Concentrate in the anthills. And this has been extremely poor, you see. Then you expect that all these so many things. The yellow lines were what's happened in this previous year, applying all this information that I had. And then, biological factors. This is my favorite, but I will go very rapidly. Well, let me get it back. Hubble opened up the universe for us. When I was a kid, I was just looking at Mars, if they have channels or whatever. And with Hubble, you have good eyesight. There is red square. That's our solar system, part of the Via Láctea, which is one of the hundreds of galaxies that we have discovered. This because we had an instrument. Now, moving on the opposite side, with the new techniques, looking of imaging, you can see what is happening inside the brain of a child. Red indicates that they're taking glucose. It means there is some mass there. You see temporal lobes and the frontal lobes of a healthy child. And then you see the same of an abused child. You see that he doesn't develop the frontal lobes and the temporal lobes, which is related to emotions and control. So we know that child abuse alters this. And then what do the prefrontal cortex? These are the functions. These are the functions that are typically human. Just a minute. These are the prefrontal cortex. This is the typical human activities: planning, attention. You cannot think of a colony of primates paying so much attention to anything that is taking place. It's concentration, control of impulses. This is typically activities that are in the prefrontal cortex, the latest addition in the evolution. And then what is particularly important, empathy, the capacity of suffering with the other. These people that do not have this well-developed prefrontal cortex have all these deficiencies. And so the thing I am now is, if we want to control in Colombia, if we want to control all this violence, what about a hypothesis? This is Peter Drucker, a famous business consultant guru, that says, what everybody knows is usually 20 years old. So we are now things that nobody knows yet.
Rodrigo, we have to almost wrap up if we're going to continue on time.
This is it. One common mistake is to go from an idea into a full-blown operation. Don't omit testing the idea. So where I am now is testing the idea if child abuse can reduce youth violence. Preventing child abuse can reduce violence. And this is it. Cali is well known for its salsa. You want to go there. And you see some references I put them down. And finally, as an explanation, why a PhD in epidemiology from Harvard, respected thing, ended up in politics. Because medicine, as Bischoff, which is a famous German pathologist, said, is a social science, and politics is medicine in a larger scale. Thank you.